Welcome to the Cheetah Starling SV System Overview and Buttonology Training Module. This presentation will cover the following learning objectives. Understand the Starling SV non-invasive hemodynamic monitoring technology. Understand the components of the Cheetah Starling SV system. Understand how to set up the Cheetah Starling SV system, apply the sensors properly, and perform fluid challenges. Learn to run the monitor InService videos for quick reference during system use. Starling SV is an FDA-approved 100% non-invasive hemodynamic monitor, which measures stroke volume along with numerous other advanced hemodynamic parameters, including stroke volume index, cardiac output, cardiac index, and peripheral resistance. Clinicians currently use the Starling SV for volume management and to ensure fluid optimization in patients with a wide range of disease states. Since the Starling SV is 100% non-invasive, it is the ideal hemodynamic monitoring solution to be used across the continuum of care. This table displays some of the hemodynamic parameters available from the Starling SV monitor. Note that the table also contains the basic equation used to calculate the parameter, as well as normal adult ranges for each. Use this information as a general reference only, and not for clinical decision-making. There are three primary components of the Starling SV system. The Starling SV monitor shows the parameters discussed previously and includes a touchscreen for easy navigation. Cheetah sensors are 100% non-invasive and are applied to the upper and lower thorax, boxing the heart. The sensors send the signals captured from the body to the monitor. The patient cable connects the monitor to the sensors. The pictures show the Cheetah Starling SV system, sensors, and patient cable. Proper sensor placement is depicted on an actual patient. Note that the primary criteria for placement is 2 sensors above the heart, 2 sensors below the heart. Next, we will transition to Cheetah Starling SV monitor operation. Turn on the Cheetah Starling SV monitor. To turn on the monitor, press and hold the green power button located in the lower central area of the Cheetah Starling SV monitor until it beeps. Once the monitor is turned on, it takes about 50 seconds for the monitor to boot up. The optimal order of operations is to turn the monitor on first, then apply sensors to the patient. Once the sensors are applied, the monitor should be ready for you to enter the proper patient data. The main menu will appear on the monitor screen with the options of selecting an existing patient, adding a new patient, changing the settings, or shutting down the monitor. To add patient information, select Existing. The Cheetah Starling SV has over 400 hours of memory for storing patient data. If selecting an existing patient, a list of patients will appear on the screen. Ensure proper selection of the existing patient from the list available by reviewing the patient ID and name provided. To select a patient from the list, touch the screen for the proper patient. Confirm the data entered for this patient is correct. Then select Run to start monitoring the patient. To add a new patient, select the New Patient option from the main menu screen by touching the screen in the correct location. The Cheetah Starling SV system will proceed through the various screens so the proper patient information can be entered. Enter all patient details including enter patient ID, then select Next, enter age, then select Next, enter height, then select Next, enter weight, then select Next, enter gender, then select Next. Note that patient ID, age, weight, height, and gender are required fields that must be entered for each new patient. This is mandatory since the cardiac index and stroke volume index parameters incorporate this information into the calculations. After entering the patient identification number, select Next. After entering the patient age, select Next. After entering the patient weight, select Next. After entering patient height, select Next. After entering patient gender, select Finish. Once all the data is entered, a patient review screen will be shown on the monitor. Review the information to ensure it is correct, and if so, select the Run button on the touchscreen to begin monitoring the patient. If the data is incorrect, select Update Details to edit the data, and then select Run to monitor the patient. The Starling SV displays a sensor placement and connection help screen prior to data collection. Note that green sensor images show good connection and data collection can continue. Red images indicate disconnected or poor connections. Fix the problem until all sensor images show green, then continue. Note the example where sensors flash red if not correctly attached and/or are poorly connected. Correct the sensor connections until all 4 sensor images show in green. Calibration automatically occurs and takes approximately 2 minutes after selecting the Run button on the touchscreen to begin Starling SV monitoring. Ask the patient to relax, remain motionless as best as possible, and not talk during calibration. A red bar appears at the top of the screen indicating that the calibration is in progress. At the end of calibration, manually enter the map from A-line or bedside monitor to obtain TPR and TPRI if you are not using the Cheetah Starling SV NIBP cuff. Note that the system needs to be recalibrated after replacing sensors. To ensure optimal operation, check sensor placement and time of sensor placement at the beginning of each shift and recalibrate. Check sensor placement and time of sensor placement when hemodynamic numbers are in question and recalibrate. Other situations to consider Starling system recalibration. When sensors come off or are replaced, the system must be recalibrated. Sensors have a lot of flexibility for placement within the 4 quadrants. However, once they are placed, the system must be calibrated from that position. It is okay to disconnect the lead wires from the patient cable and reattach afterwards without recalibration. Always check sensors each shift or after patient movement, and if they need reattachment, recalibrate. There are numerous screen display options on the Cheetah Starling SV monitor. The Run screen, Dashboard screen, Numerical display screen, and Trends display are options that can be shown on the monitor depending on user preference. All screens are available in real time by swiping the finger up or down on the display. These various screens show many of the same parameters such as stroke volume and stroke volume index, cardiac output and cardiac output index, total peripheral resistance, etc. The Run screen primarily shows the stroke volume, heart rate, TPRI, SVI, and shows the actual cardiac output signal from the sensors. The Dashboard screen shows more parameters, and the Numerical display screen shows the parameters in a different format, while also showing the various challenges and impact of those challenges on the screen. The Trends display screen shows similar information as the Numerical display screen, though in graphical format. The Sessions Control option shown in the lower left-hand corner of the Cheetah Starling SV touchscreen display allows a user to navigate through the various settings as well as to initiate protocols for passive leg raise and fluid bolus. During monitoring, the patient's normal value data is available for display. Select the View tab followed by Normal Values. A range of hemodynamic normative values is displayed for reference during monitoring. Selecting the menu box will open numerous options. The Event option allows different events to be entered. Example of an event: dobutamine started at 2 micrograms per kilogram per minute. These events will be marked on numerical and trend screens. For the non-invasive blood pressure option, NIBP, select BP on the menu. A clinician may initiate, end BP, or change the time interval to every 1 to 90 minutes. Select the SpO2 option to initiate continuous O2 sat readings when probe available on the Cheetah Starling SV system. View may change grid parameters on dashboard screen, test controls to initiate calibration or pause the monitor, protocols for passive leg raise or fluid bolus protocols, manual data entry to enter MAP, SpO2, or hemoglobin. When SpO2 and HB are entered, DO2I will be displayed. Switch display to display different screens. Exit to turn the monitor off. Events can be added on the Cheetah Starling SV monitor to be incorporated into the patient record. Examples of events are fluid administration or administering medication to the patient. To add an event to the patient record, such as medication administration, fluid administration, etc., please follow the instructions on the screen. To end monitoring a patient or to shut down the system, access the main menu in the lower left-hand corner, select the Exit button, and then Shut Down. Starling SV has InService capabilities. Select InService from the main menu. Topics include bioreactants, how the technology works, passive leg raise, instruction on the proper application of a dynamic assessment such as PLR or a fluid bolus challenge, proper sensor placement, and understanding the Starling SV monitor. The in-service videos have different run times, ranging from a few minutes to approximately 30 minutes. This concludes the Cheetah Medical Starling SV System Overview and Buttonology module. Please refer to the IFU User Manual for additional user application instruction, troubleshooting, and maintenance information. Thank you.